Okay, this is for Speech 205, Horry Georgetown Technical College, Professor Luce. The camera is going to pan the audience. And then my cameraman is also considered an audience member. Okay, so hepatitis C is an infection of the liver that affects 3.2 million people in the United States a year, but is curable. It is a blood-borne pathogen. Hepatitis C affects the liver. A normal function liver produces bile, detoxifies blood, and stores glucose. The causes and risk of hepatitis C can be caused by activities but are not limited to IV drug use, having unprotected sex with an affected person, sharing needles, and working around body fluids. Some people are at higher risk than others. Those who live with an affected person, those working with or around body fluids, dialysis patients, drug users, recipients of blood donations, and organs. Symptoms of a person with hepatitis C include fatigue, abdominal pain, jaundice, which is yellowing of the skin or eyes, fever, and vomiting. Hepatitis C can be diagnosed by blood test. First, you're going to do an antibody test, and if you come back positive for an antibody test, then you will have a HCV RNA test, which will determine whether you have the active virus and whether it is positive or negative at the time. If that comes back positive, then you'll have an HCV viral load, which will explain how much of the virus is in your blood system. There are also different genotypes for hepatitis C, and that will also be determined on your treatment by your doctor once you're diagnosed with the virus. Treatment can vary for hepatitis C. Years ago, they only used interferon, which was an injection, which had the same effects as chemo did. Your hair fell out, your weight dropped. Now there are new treatments. Hervani is the most popular one. It's a mixture of two medications, and it has a 96 to 99% response rate. It is a 12-week program, and the average cost is about $94,500. Hepatitis C is an infection that affects the liver and affects 3.2 million people in the United States. There is no vaccine for hepatitis C. If you think someone you know may be affected by hepatitis C, please contact your doctor immediately. You can stop it. The end.